Hi friends, welcome back to Coffee with Ravi. Today my post is about 7 ways to decrease cancer risk or prevent cancer. In fact, there's more than 7 ways, but I thought 7 sounded cool. Number 1 way that we can do to prevent cancer is having periodic colonoscopies or even something to screen for colon cancer, such as other tests like Cologuard, but colonoscopy is preferred. Cancer is very common. The lifetime risk of a person getting cancer is in the range of 30%. However, the good news is that with these screening measures or these measures that I'm talking about, that risk can even be cut to 50% or 60%. And that's a big number if you think about it. So keep that in mind as we talk about this. The second thing that one can do to decrease risk of cancer is to stay away from tobacco. Tobacco, as we know, causes all kinds of cancer, starting with oral cancer, stomach cancer. If you're chewing, lung cancer, of course, is big. It increases the risk of pancreatic cancer, a whole host of things. So don't chew, don't smoke. In my previous post, we had talked about how to quit smoking, and I think it's worth revisiting with your physician or primary care provider. The third thing that we can do to prevent or decrease the risk of cancer is to exercise. Every form of exercise, that is walking or aerobic or running or whatever is the maximum we can do, along with some weight training, which can be not necessarily lifting heavy weights, but even simple things like squatting, push-ups, body weight exercises. The combination of this seems to help in preventing cancers, especially breast and gut cancers. And along with that, staying at a lean weight around the middle. Any kind of gut or visceral obesity seems to raise the risk of GI cancers. The fourth thing we can do is eat a plant-based diet. There are many studies now that are coming out that show that as we shift to a more plant-based diet, our risk of gut cancers and other cancers seem to be going down. Alcohol, even though in the past there was this question about moderating alcohol, I think it's more and more data is coming out that zero alcohol or minimal alcohol prevents cancers, especially gut cancers, etc. And alcohol seems to be a driver of the cancer process. The next thing we can do is get our younger children vaccinated for HPV. HPV virus is associated with genital cancers and oral cancers, and there's now vaccination available, and that is a simple, low-reaching strategy. In other words, simple strategy to reach for that will prevent us from getting these cancers. Breast cancer screening is very important so that you keep thinking about it, keep thinking about self-breast exams, keep thinking about mammography, and along that note, cervical cancer screening I think is going to be important. So keep thinking about this. This is a checklist for you. Another thing that we can do is hepatitis B and hepatitis C. Because they damage the liver, they can also put one at risk for liver cancer and other cancers, so that if we practice safe sexual behavior, in other words, use barrier precautions such as condoms, etc., those would be helpful in preventing sexually transmitted diseases and the consequences of sexually transmitted diseases, which can be hepatitis B, hepatitis C not as much, but HIV, and these then have downstream effect of causing some cancers or putting one at risk for cancers. So that's important. Along the same lines, safe tattoo practices or safe needle practices are actually also helpful because they prevent spread of hepatitis B, C, and HIV. The next one is lung cancer prevention. If one has smoking history after the age of 50, there's lung cancer screening through a CT scan, and that is helpful in picking up lung cancer at an early stage. But it goes back to the earlier point, which is to avoid or to quit smoking, because that's the quickest thing that you can do to bring down the risk of cancer. The last two are prostate cancer screening, which is slightly controversial in terms of getting a blood test for prostate-specific antigen, but talk to your physician regarding the pros and cons of it. And lastly, skin cancer prevention by wearing sunscreen, by being smart about sun exposure, And then on the other side of it, when you go in to have your primary care checks, make sure that a good skin exam is done. So therefore, if you're able to do all of this, I think your risk for cancer can easily be halved. So think about these measures, and if you have questions, please call me.